Hello, my name is Twyla Braze, President and co-founder of the Citizens Council for Health Freedom, and I am so glad to have you here listening today as I talk about a major alert from the Minnesota State Capitol. Now, you hear Minnesota and you might think that that doesn't pertain to you, but if you have ever gotten cancer treatment in the state of Minnesota, if you come to Mayo Clinic, the University of Minnesota, or up in Duluth, Minnesota, which is right next to Wisconsin, or any of the other border clinics and hospitals, please stay tuned because this pertains to you or your family members, or someday if you do come to Minnesota to get cancer care. So the Minnesota legislature has decided that it is going to open up the cancer surveillance system to the rest of the United States. So to all 50 states as well as the federal government. And we would like to stop them from doing so. And so I'm going to ask you to take action today to stop this from happening. So please, I'm going to show you the bill, and then I'm going to show you the actual language big enough so that you can read it, and then also what you can do and the rights that are being violated. So let's begin. So here's the bill. It is House File 1329 and Senate File 2341. And this is the entirety of the bill. It is only one page long, and this section down here is what I'm going to show you on another sheet of paper with the letters much larger so that you can actually read them. Now, the interesting thing about this is that the Minnesota cancer surveillance system has never opened up to anyone outside the state of Minnesota. Other cancer registries across the country have, but Minnesota, for the entirety of its 25 years, has essentially had a locked gate around it because privacy is really important in Minnesota. So you can see here, this is from the Minnesota Department of Health, a document they created as they're trying to open up the registry. And what they show here is North Dakota, South Dakota, and Wisconsin, who have open registries and all the data that's available because they do. But this is the state of Minnesota here. And we put the words privacy protected, no data provided, because that's why there's no state there, there's no picture there, is because it has been closed to outsiders. But now the legislature wants to open it up. Here are the words that from the bill so that you know what I'm saying about other state cancer registries and federal agencies. So here's the first one. Well, this is the bill number up here. This is the title called Transfers of Information to State Cancer Registries and Federal Government Agencies. So if you're outside the state of Minnesota, this pertains to you. Information containing personal identifiers of a non-Minnesota resident collected by the Cancer Reporting System may be provided to the statewide cancer registry of the non-resident's home state. This means whether you're in Maine, whether you live in the state of Maine or Arizona or Texas or Nebraska or Washington or wherever you live, if you have come to the state of Minnesota for cancer care, your information will be shared with your home state, or however perhaps many home states you have had that you have got medical information in. All right, this is the other part of the bill talking about federal access. It says information excluding direct identifiers such as name, social security number, telephone number, and street address collected by the Cancer Reporting System here in Minnesota may be provided to the Centers for Disease Control and Prevention's National Program of Cancer Registries and the National Cancer Institute Surveillance, Epidemiology, and End Results Program Registry. This means that the CDC and the National Cancer Institute are going to get access to your data. Now you might say, well, it's de-identified, it won't have my name. So it's really important to hear what another federal committee has said about de-identification. The National Committee on Vital and Health Statistics says, even data properly de-identified under the privacy rule may carry with it some private information and therefore poses some risk of re-identification, a risk that grows into the future as new data sets are released and as data sets are combined. And if you watch what's happening around this country, you know that the data sets are increasing and the combining of data sets is happening both through artificial intelligence and elsewise. So, what are the rights that you will lose if this bill becomes law, both for people in Minnesota and people who are not in Minnesota but have come here for cancer care? Here are the rights you'll lose: medical patient privacy rights, constitutional rights, state and federal, because of course both the federal and the U.S. Constitution and your state constitution say there can be no search or seizure of places, persons, things, and effects without a proper search warrant. So this we have never supported the cancer registry, but we certainly don't want it now to be opened up to the entire United States of government officials. You'll lose ownership rights over your data because they have claimed essentially that your data is theirs and so they can do with it what they want. And you'll lose the right not to be a research subject because they will put you in research and they will do that without your consent. So these are the rights that you will lose, and so we ask you to act by contacting your state legislators if you're inside the state of Minnesota, and if you're outside the state of Minnesota, contact people you know inside, or just look up some legislators in Minnesota, particularly the authors of the bill, which I have the names right here. Authors. The House author is Representative Ned Carroll from Plymouth, Minnesota, and the Senate author is Senator Kelly Morrison, a physician from Deep Haven, Minnesota. People who are in Minnesota can they can just look up who represents me or who represents you in the state of Minnesota, and then that will tell you. You just put in your information and you'll find out who your legislators are. You can send them a quick email, give them a quick call, and try and make a difference here, because we think it's possible with only one vote difference in the Senate that we could perhaps stop it in the Senate. So thank you so much for spending time learning about this really important issue. We don't want to lose these privacy rights in the state of Minnesota. We don't want to lose them for anybody. Actually, we just want to lead the country in protecting privacy, but we do need your help. So please take action. Our website is cchfreedom.org, cchfreedom.org. And then feel free to use this information, go back over the video and use the information that we've shared in order to make a difference and to stop this bill. Thank you so much.